Why is health promotion for people with intellectual disability important? What does health promotion mean, and how do we do it? The World Health Organization, in the Ottawa Charter of 1986, defines health promotion as the process of enabling people to increase control over the determinants of health and thereby improve their health. The social determinants of health are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. These forces and systems include economic policies and systems, development agendas, social norms, social policies, and political systems. Health promotion is important for everyone. Health promotion includes health education for individuals, preventative health programs such as immunisations, and healthcare advocacy for systemic change. We know that people with intellectual disability are disadvantaged and that their healthcare and health are generally poor. We know that preventative health needs for people with intellectual disability are often overlooked. And we know that they don't receive much health education. The fundamentals of providing health promotion are clear communication, two-way interactions, involving participants, repetition and reinforcement of health messages, and advocacy at a higher organisational or systemic level. Get participants to summarise the information and repeat the main messages. If someone has complex communication needs, then they will need a support person to help them get their message across. Keep information short and sharp and to the point. Use verbal explanations, diagrams, images, handouts, all kinds of communication strategies. Stick to 3 main messages and keep things interactive. Treat adults as adults and speak at a moderate pace. Use easy language and short sentences and explain technical terms in easy language. Be expressive in your facial expressions and in your body language. Consider impairments such as hearing, sight, comprehension, and literacy. In health promotion, our main role is to facilitate the sharing of group knowledge and experiences rather than to present content information. Positive affirmation and celebrating success encourages participation and builds confidence to make changes. Interactive exercises take time. Timekeeping is important and instructions need to be clear. Some interactive techniques that we've used include brainstorming questions and examples, asking the audience to summarise the main points, arts, craft and group exercises, quizzes and games, role plays and mock scenarios. Throughout the year, we involve participants in planning. Our annual calendar often reflects a balance between group interests and our professional judgment or organisational requirements. Once or twice a year, we brainstorm new topics and then vote to prioritise them. Developing information materials with participants is a useful way of developing resources for peers, by peers. Developing printed information resources in partnership with people with disabilities is a great way to develop a sense of ownership over the messages, make resources which are relevant and which include images of people with disabilities, celebrate the successes of participants and role model behaviours. Health topics and messages are provided more than once and with different approaches and presenters. Many messages are integrated into different topics. For example, diabetes management reinforces nutrition, physical activity and medication compliance. Dental health reinforces diet and regular health checks. Mental health reinforces physical activity, help-seeking behaviours and medication compliance. Some people with disabilities experience anxiety attending clinical health services. Health service tours are a practical, easy and fun activity that support people with disabilities to meet staff and develop a positive impression of the service, learn about the service and what to expect when they attend, Promoting the tour also promotes the service amongst disability networks and provides opportunities for health staff to receive training before the event. Getting political means involving key policy decision makers involved in the health promotion activities, or even linking to national or local health campaigns. Speaking with mainstream providers and getting them involved can make a world of difference. Here is an example. An outreach dental service started to provide dental services on site at workshop events. They come to the event with qualified dental staff and mobile dental equipment and set up in a private room in the church hall. Some participants had refused to go to the dentist for years due to anxiety and fear. Over a couple of months, one participant met the staff, walked past the clinic and spoke to his friends who had attended. He ended up having an examination and several fillings completed, and then he accepted a referral to a permanent clinic for more significant work. Health promotion basically involves health education for the individuals, preventative health such as diabetes reduction and management, and health advocacy. The fundamentals of great health promotion involve clear communication, two-way interactions, involving the participants, repetition and reinforcement of health messages, and advocacy at a higher organisational or systemic level. So remember, we all need and deserve good health promotion.